I'm a firm believer in the community hospital model of delivering care. I'm also a patient here. I've been in for various procedures, and I found the quality of care to be excellent. Even with my hospital Johnny on, they do still treat me with respect.
I have a wife and I have 4 children, all girls. So we have a strong connection to this hospital, and hopefully if we have any more children, which I don't think we will, that they will be born here too.
I bring my family here for all our care. My 2 children were born here. I've had surgery here. My wife's had surgery here. In the 13 years I've been here, we haven't been anywhere else for any of our personal health care. And I wouldn't want to work someplace where I didn't feel that way.
My 16-year-old had a concussion while playing soccer, and we ended up using our own facility. I must say, I was, being on the other side, I was quite impressed.
Well, when you live in the same area where you practice, all of the things that are influencing your patients' lives are also influencing your life and the lives of your family and children.
Excuse me.
You don't have that factor of having a complete stranger sitting across the desk from you. It's someone you know. You really understand the lives of your patients better.
You walk through the hospital doors, and there's a huge different facelift to Beverly Hospital over the past 3 years.
Just the front lobby, that alone, I think the attractiveness of it and the stature of it makes you feel like you're going to a substantial place.
Get a nice registration area.
If a patient comes through the door and they kind of look around and say, wow, this is a really warm, comfortable place, it just kind of lowers their heart rate and it makes them feel a little bit more comfortable about their experience that takes place here.
More important, though, are the clinical side of things that we've done. I mean, the improvements in the emergency room. The emergency room is much larger, it's much more efficient. The outpatient imaging and the daycare surgery site really, I think, is a major improvement.
The other major advance of the hospital is the new Beverly Hospital at Danvers site. The Lifestyle Management Institute has been moved over there. Cardiovascular Institute is over there.
My patients love going there. It's so convenient and in and out service for labs, and for the folks who live in Danvers, Topsfield, Linfield, Peabody, it's easier to get to. So there's been a real commitment to having services based for the community while building up the hospital and having our own 3T MRI and having our excellent obstetrical service and pediatric floor staffed by Children's Hospital physicians.
Our patients don't necessarily have to go into Boston to get the same kind of testing and evaluation. We can do it all up here, and we have the specialists that go along with all of this modern technology as well.
I think most community hospitals don't have the high level of equipment that we now have, the brand new stuff that we have at our outpatient center, and the brand new site that we have here at Beverly for the cardiovascular work. I mean, that I think is relatively unique and certainly out in front in terms of most community hospitals.
This lady has an acute compression fracture in her thoracic spine. In the old days, that was treated with bed rest and a lot of pain medication. Now we glue them back together.
That's the needle. Yep.
The patient has severe back pain, and they're going to be doing a procedure where they, with image guidance, put needles into the bone and a balloon into the bone, and then fill the bone with cement to essentially fuse the fracture for pain relief.
90% of the time, it's dramatic relief within a couple hours. They go from not being able to roll or sit up in bed to getting up and walking around and going to the bathroom.
You know, to some extent, every hospital has to keep going and make these advances with imaging and interventional type procedures, but I think here we are ahead of the curve.
See, that's what my 80-year-old patients say.
A lot of what we do, we provide services to patients, but we also provide services to each other. One of the best ways that we do that is to involve the other caretakers. And the advent of the hospitalist system has taken the country by storm in the last 5 years. It's patient outcomes, they do better in places where the hospitalist system has been implemented.
I think one of the strengths of the hospitalist system is they're there 24/7. Chest pain at 2 o'clock in the morning, you have the hospitalists who are there in 5 minutes. Myocardial infarction, stroke, they're time limited. You have a window to treat these conditions. So I think just from that perspective, this is a tremendous step forward in terms of the quality of patient care on an inpatient basis.
I'm really proud to say that my community hospital is also supportive of addiction medicine, which gives service to some of the folks in our community who are most in need of it.
Again, NHS is really quite extraordinary in having the largest provider of addiction services, the largest provider of outpatient mental health services, and this extensive inpatient behavioral health division, including Bay Ridge, the Leland unit, the senior adult unit at Addison Gilbert, as well as our services on the consultation service and into the emergency departments. The senior adult unit, for instance, has consistently scored in the top 10 percentile, oftentimes in the top 5 percentile, on patient satisfaction. And Shirley Conway came to be the head of nursing there. And as a matter of fact, she's recently been given a national award from Sigma Theta Tau for her leadership in geriatric nursing.
This is the largest orthopedic department on the North Shore, and we are doing the exact same minimally invasive surgery and potentially more than any other hospital in the Boston area, including all the teaching hospitals in Boston.
Our skills, and we can do state-of-the-art laparoscopic surgery, the same minimally invasive techniques that are done in town. Our endoscopy, we can do the same things as are done. Same approach of screening colonoscopy, removing polyps, same techniques.
But the care and the feedback from patients when they come here for a preoperative visit, for the preoperative hold, surgery, and then actually the postoperative care suites is unbelievable. Are we almost ready? The hospital has provided us with the equipment, with a dedicated orthopedic staff, and really with the time and the infrastructure to take care of patients effectively.
These are plans for our 3 new operating rooms, 2 which should open soon, and then we'll have a lot more access and be able to get more done in a more timely fashion, which will be great.
I mean, that'll be a big factor for helping the current base of surgeon here and actually, I think, providing more accessibility for even more surgeons to want to utilize this system. All right.
The changes around Beverly Hospital and the Beverly Hospital system certainly have changed with the times, and I've always felt from the time I started here that I could provide really good care. Very nicely done. People really like being treated in their own communities, and our luxury here is that we have very great facilities and very local.
I don't think there's a whole lot that we can't do here. And I don't think we have too many limitations, frankly.
For most of the medical services that most human beings will ever need, you can get them here, and you can get them with a medical staff who knows you and who's going to see you a year, 2 years, 10 years down the road.
We are very well positioned to expand and grow and do novel and innovative things. And I think this is a place that cares. This is a place that wants to be at the cutting edge of therapy, and this is a place that really wants to be a leader in the community.
The vision is right on in terms of where we want to be and what we want to be doing. And I couldn't be happier practicing in this environment.